Good morning, and welcome to Health Talk here on AM 1270 and 96.5 FM KXPX. I'm Paul Thomas in the studio with Bill Kearney of Northlake Medical Pharmacies. And Bill, welcome back to the program.
Well, thank you.
How have you been?
Well, doing good. Getting ready to go on my fishing trip that I go on twice a year. So leave tomorrow morning to go up to Lewiston Lake and fish for some trout. And have some imbibe and some...
It's some spirits?
And some spirits, and enjoy the weather. It looks like the weather's going to be a little cool up there in the high 30s at night, and but really nice during the day. So we do this twice a year. It's called the Derby Hat Club, and so we've been doing it for 40-some years, I think. So anyway, we're looking forward to getting away, and then next week I have a board meeting in New Orleans, which is
that'll be fun.
Well, it would be if I wasn't in meetings all the time. You know, my wife isn't able to travel with me because of her knee replacement, so I'll be behaving anyway because she's the spark in my life. I sit in meetings most of the time, and
is this your first time to New Orleans?
No, I've been there before, but I've never been there to have a vacation. I've just been there at meetings and work. So I'm sure I'll have a few minutes to enjoy at least the food there. And this is funny. I was looking on the internet this morning, and I was thinking about us fighting weight all the time. And it was saying 25 ways to shrink your belly in 24 hours. You know? So I went through all those. It was exercise, no alcohol, no carbohydrates, eating things that you would never even imagine that you would eat. And some herbal things that were marginal, to say the least. And then it was diet and exercise, and drinking tea or just tea, not coffee. And milk products, of course, would cause you to bloat up. And evidently, this was to maybe be able to take another notch in your belt for a day, and then if you didn't observe those same kind of things, that you would probably have just as big a belly as you did before. So it all goes back to the same thing: diet and exercise. I had a lady yesterday that was a diabetic and wondered how she could get her blood sugar down without taking insulin. And she was a type 2 diabetic, which is one that the diabetes comes on at a later point in your life, and your pancreas does secrete insulin. It just doesn't secrete enough to get rid of to lower the blood sugar. So, I told her it's exercise. You can bring your blood glucose level down by 20% if you exercise every day. I've never had a diabetic problem, and no one in my family has, but I've seen the people that do that. And when I was talking to you a couple of weeks ago, you were going to start doing that. Did you attempt that? You keep nodding your head. Yeah, Paul is the silent one. He's not really enthusiastic about this.
No, I discussed it with my wife. I thought, hey, maybe I could walk to work and back, and then, that would be a little bit of exercise. No, I haven't done it. My problem is, I get off so late now at 6. It's hard for me to want to go to the gym at 6 o'clock. I want to go home and, have dinner and have my evening at home, and so I have to at some point, I guess, sacrifice somewhere to do that. And in the morning, I'm up and taking the kids to school, and there's an opportunity maybe if I got up earlier in the morning to do some exercise, But again, I'm not motivated to get up extra early to go exercise. So as of now, no, I haven't done it. But I will tell you, I have quit smoking again.
Oh,
yeah,
wonderful!
It's been about 3 weeks now.
Wow, completely?
Not completely. I did have one cigarette Sunday during the 49er game, kind of throughout the whole day.
That would cause me to eat another bag of potatoes.
Well, and that's what it was. I made a pot of chili, and we were, toasting the good fortunes of the Niners with our spirits, and and then that just all leads you to want to continue to go down the bad path, and so I had a cigarette, but I haven't bought any, and I haven't had any, and I haven't been smoking any for 3 weeks, so I'm actually quite proud about that. And
I'm proud of you too, because that's a tremendous addiction.
Yeah, it's a hard one to, and I've been dealing with it for years now, where I'll do it and then I won't. And I had a period of a year that I had quit for almost a year, a couple of years ago, and then flew to Texas to drive my sister-in-law back from Texas with the big U-Haul. And my wife, back then I was, as dealing with fatigue a lot because I wasn't getting good sleep, and that was kind of at the beginning of when it was starting to really affect me. And she was worried about me driving and getting fatigued while driving, and she said, well, if you need to buy some cigarettes to keep you awake, do it. Well, that was a bad thing because I instantly went right back into it again.
Yeah.
And but now I feel so great from the extra good sleep I'm getting from being on the CPAP machine. I'm not fatigued like I used to be, and I think that I don't have the cravings like I used to have. Like, my drinking has been cut down a lot. I don't drink as much as I had. I'm not, sometimes I don't even drink at all at night. And mainly on the weekends I'll have a couple drinks, and that's kind of where I'm at now. But tonight's the Giants game. There might be a couple drinks going on during the Giants game because it's the playoffs, you know what I mean? And it's funny how in life you find reasons to celebrate that way, and and so my wife seems to think she thought I've lost some weight, and
I told you that a couple of weeks ago.
Yeah, so I think it's all, and I'll get to the exercise part of it eventually. I'm sure I will. I have to go see the cardiologist Friday, so if he tells me my heart's bad, then I guess I got to do something.
Well, that extra energy can give you the impetus to do some exercising too. But I didn't plan on talking about drinking or anything, but I did read a thing yesterday about the guy that was on 24 Hours, that Sutherland, Kiefer Sutherland.
Yeah.
He said, because drinking has been a problem for him, and he said, I'm not going to give it up. He says, any time I've gotten into trouble, it's been alcohol. Mm-hmm. Otherwise, it doesn't interfere with my work most of the time. It doesn't have. But he says, I enjoy drinking with my friends. I enjoy going to a bar and drinking with my friends. And he says, unless it becomes something more than that, he says, I'm not going to give it up. And he admits that it's been a problem for him. But those kind of things are hard for, especially if you're fighting weight and those kind of things, they all add into that. And of course, they lower your threshold of, just like smoking, after a couple of drinks, it doesn't seem so bad to do that. But we're going to be talking about health today, and your health. If you listened to the vice presidential debate last night, you heard about one side was going to give medical benefits to everybody for free, and the other side was going to abandon Obamacare and make it a much different policy. And probably Obamacare needs to be changed considerably. It's almost too expensive for people today, and we have to do something to change that, and even Obama admits that as much as he doesn't want to. But we're into the flu season now, and vaccines, and we have all kinds of questions coming up with people that are more educated now about getting immunizations than ever. one of the things that we look at when we have them fill out a questionnaire is if they've had flu vaccines before, number one. Number two, if they're over 65, if they've had pneumonia vaccines yet. There's two of them on the market, the Prevnar 13, which is the one if you haven't had a pneumonia shot you take now, and then the Pneumovax 23, which is a year later you have that, and then that's all the pneumonia shots you need for the rest of your life as it goes now. We also ask about tetanus. If people have had a tetanus shot in the last 10 years, and you'd be amazed at what the amount of people that haven't had a tetanus shot in the last 10 years. The difficulty is most insurances won't pay for that. And the other one is if they're over 60 years old, is if they've had the Zostavax shot for shingles. Now, a lot of the insurance companies pay for that if you're over 60. They won't if you're 59 or younger. So, and then there's the different kinds of flu vaccines. The ones that we've had for years and years are trivalent vaccines, which are 3 different strains of the flu. And last year we didn't change those strains at all. It was exactly the same thing as it was the year before. This year there are 3 different strains, and so if you think because you had it last year you don't need it this year, that's incorrect. The immunization actually fades over a period of time. So although there are some of those antibodies in there that work for a year, very few to be effective against preventing the flu. And then there's whether you want the quadrivalent or you want the high dose one. There isn't any evidence that supports that you're less likely to get the flu because of those other 2 doses, strains. Next year we're going to put some of those in just because there's been a few requests for it. The reason we didn't order it this year is they weren't paying for it. They were paying the same price as they were paying the insurance companies and the government as they were paying for trivalent vaccine, which is the one that most people immunize with. So we weren't going to get reimbursed. That sense has changed. The other one that you've heard us talk about a lot in the last few weeks is the nasal spray, which is an active vaccine that was for children, and there isn't any, and it's not effective at all. So there isn't an option for children now except to get the needle. And Paul's son did not like that 3 years ago. And
no.
He mentions my name to his son now, and Matthew just looks at him like, I don't want to see this guy again. So
he's going to this year, for sure.
So we're right in the middle of the season now. We actually have some people actually getting the flu this early. A lot of those kind of viruses around that we need to really take care of as soon as possible. So there is some discussion about people that are over 65 years old of waiting until Thanksgiving or something to get that vaccine, because when it starts to wane, when the amount of immunization starts to decrease, if you get it in September or October, it's less active in February or March. Usually the flu season has peaked by that time. But that's a clinical discussion that people have, that there's as many on one side as there are the other side. If it were me, since people over 65 are a very susceptible group of individuals to get the flu, I would probably want to get it early rather than later and hope that if it peaked later that I would be covered. You can't get a booster shot. It doesn't make any difference about that. And if you're allergic to eggs, now they're telling us that not to worry about your allergy to eggs. Unless you're having an anaphylactic shock, which most people do not, they get a little rash, The CDC, the Center for Disease Control, says it's not a large enough reaction to have somebody avoid getting the flu shot. So we're going to take a look and try to talk people into getting that shot and have them just be aware that there may be some sort of visible reaction, but it's not life-threatening or anything similar to that.
Bill, we got a call coming in.
Okay.
Make sure we're on the right one here. Let's see. Good morning. You're on Health Talk.
I'm sorry, I have the wrong number.
Oh, okay. Thanks. Bye-bye.
Okay, our number is 263-5252, 263-5252. If you have any questions about what we're talking about, we'll be more than happy to answer them or try to answer them. If we can't give it to you now, we'll give it to you when we get the information. So,
have you noticed any increase in allergies over the last week or so?
Paul, I have never had allergies like I've had this year.
Yeah.
You know, I was only taking an antihistamine decongestant before I did this show because I talk for an hour and I drain a lot. I mean, I have not been able to sustain the sneezing and eyes, and I finally had to take out my daily contacts because I was blowing them out just by sneezing and stuff from time after time after time. So I had just ordered a whole bunch of them, a year's supply from Dr. Browning's office, and I would drain so much. First of all, they'd fog up completely, and when I would take them out, I couldn't put them back in. And it's just been probably the worst year that I've had in a long time. And I grew up with really bad allergies. I grew up on a farm, and I was taking Benadryl as a kid just to be able to navigate. But I never had it when I first moved here because of all the walnuts and the grapes and the pears and the kiwis and all that, and now the marijuana. It was really toxic to me, but I adjusted to it. But this year, I can't seem to get rid of it.
Yeah.
So, and I have to take the one that has the decongestant in it as well as the one that has the antihistamine. So. Yeah, this is a tough year for allergies, and it's been, out where I live is on the lake out by Canocti, and it's been really, really windy. But I would talk to people here at night when the wind was blowing like crazy at our place. It was like during the bike challenge, and they said it was just calm as could be there. So I don't know if my location is a windy location anyway, but that stirs up all those allergens, and then I don't have any hair to have them get in my hair, but some people do, and then they lay on a pillow, and then they inhale that during the night, and they get, all kinds of reactions from the pollen that they're inhaling. So, yeah, I have, and I see a lot of people actually from the allergies getting a bacterial infection from draining all that time. So it's kind of an unusual fall, like it was an unusual summer. We predict, or the weathermen, and you're one of them, predict that this is going to be an early winter for rain in Northern California. And we certainly can use it, and it's going to be just the opposite for Southern California. So I don't wish Southern California not to get rain because they take our water up here, but it's going to be hopefully, and it's supposed to start early for October, November, and December, and then the latter part of January and February for it to start again. And that will help some. Of course, if you have allergies, then the mold becomes an issue. So in pregnancy, women will be told again that maybe acetaminophen isn't the best choice for them for pain medication, and there really isn't any evidence to support that. They're hearing that pregnant women who use acetaminophen might be more likely to have children with ADHD. But that's kind of a media type of a proponent statement. They don't have any really evidence that there is still an association that a high acetaminophen dose can cause some ADHD, but there isn't any proof that that is really going to happen. So until we find out more for adults and women to manage pain as safely as possible during pregnancy and for aches and pains, first trying measures such as hot or cold packs or physical therapy, but and topically some sort of Bengay or something like that. But they're still going to continue to recommend acetaminophen, and if oral med is needed for mild to moderate pain or a fever, it's still likely safer than the other pain meds. And a fever over 102 degrees during pregnancy can be risky to the fetus. So opiates are used next. You're going to see a huge decrease in the use of opiates, and we've talked about this many times. Just yesterday, the DEA told the manufacturers that they were going to be allowed to only manufacture 75% of what they did last year. So there's going to be 25% less opiates available. So it isn't going to be easy for a pregnant female to get an opiate instead of acetaminophen. The opiates are linked to neural tube defects, such as the tubular pregnancy, and chronic use before delivery can lead to the neonatal syndrome of respiratory distress, where the baby has trouble breathing. So we encourage the use of acetaminophen where at all possible, and stay away from the opiates, and the non-steroidal anti-inflammatories can be a problem too. So as of October 15th to December 7th, the Medicare D plans are come to be renewable. What's new for 2017 is the annual deductible for most Part D plans is going to increase from $350 to $400, or $360 to $400, and the coverage or the donut hole, that when you spend so much, you get into the donut hole, the total prescription costs reach $3,700, about $400 more than in 2015 and 16. So they're making it more and more expensive. Should you stick with the same plan that you had for 2016, you need to stick the plan that's the best for you for patient care. It varies from year to year. The formularies change, the premiums change, the deductibles change, and I think the biggest thing we're talking about is the formulary change, because drugs that were once covered, you're finding a lot of insurance companies that are going to opt out of the medications that you had in the past, especially if they're expensive. You'll also see that happening with insulin products, and many of the PBMs, the pharmacy benefit managers, like Caremark, SilverScript, Anthem, are opting out of those expensive medications, trying to get you something that is less expensive and maybe less effective. So you need to check your plans. You need to look at the star ratings on the Medicare website, medicare.gov. If you can't navigate medicare.gov, come into our pharmacies. We'll go over plans that are suggested for this area, and if it's premiums you're interested in, it will show you the best premiums. If it's deductibles you're the most interested in, we'll show you what the deductibles are. If it's the formulary that you're most interested in, then you will be able to determine what's on your formulary. We cannot sign you up unless you're in the room and say, I'm here, this is the plan I want to be on. But we're finding that it becomes more complex instead of more simplified. I, for example, have a Humana Medicare D plan. I take 6 different medications for anti-inflammatory, for esophageal reflux, and for high blood pressure. And 3 of those are for high blood pressure, and only one really affects blood pressure. The other one is for fluid retention, and the other one is for potassium that drug takes away. So far, my Humana D Medicare plan has paid $0, and I've paid $364 for my medications. And the one that's the most expensive, that they don't pay for at all, the Celebrex, I don't even run through on my plan. I just pay cash for it. And if I added that, which is almost $200 a month, I would be way over. So look at those kind of things when you look at your plans. The worst thing is to say, you know, I can't change. I don't know how to do that. Go on Medicare.gov or come in to see us. People want to know if they can change after open enrollment. And open enrollment is ends on December 7th. They usually don't allow that, but be familiar with a few exceptions if you're interested in doing that. For example, patients can switch to 5-star plans. And you've heard us talk about these star ratings before. These star ratings are whether or not you're taking medications that are appropriate for your age, whether or not you're being compliant in refilling your prescriptions, and we're trying to sync people's medications so they all can do at the same time. If that's not happening with you, let us know. Many times we'll just get the meds synced and you'll go in the hospital, and then the doctor writes a whole thing of new prescriptions and we have to start all over again. And a lot of the time that happens on a Saturday morning. You're discharged on Friday night, and you come in to get all your new meds, and we start over again. And it's not clear to you which medications you're going to continue to take and which ones that you're going to discontinue to take. So look at all those things and remember the star rating thing is very important. We are graded on that. The pharmacies are graded on that. The PBMs and insurance companies are graded on that. They want us to have a 5-star rating. Many times that's almost impossible. Both of our stores have some in the 5-star category and the rest of them in the 4-star category. If you're 3 or below, and I don't expect you to know what all these are, but it's the kind of medicines you take. If you have diabetes, the kind of medicines you take. If you're on a statin, the supplementary medications that you take. If you're not filling them on time, and we are sent a list every month by the PBM saying these people are not being compliant. You need to change, or we're going to decrease your star rating. So that's how we get paid. If we don't do anything about these issues, that you're not taking your medication appropriately, or you're taking too much, they will ding us, reduce one of our stars, and pay us less money. So we're going to take a break. When we come back, we're going to talk about some high blood pressure issues that are causing more and more people to have that silent killer syndrome. Have you recently been discharged from a hospital or special care facility and you need help in getting around your house? Hi, my name is Bill Kearney, owner of Northlake Medical Pharmacies in Lakeport. My wife, Dana, and I own Northlake Medical Pharmacies in Lakeport. And for the last 6 years, we've been offering a new service in Lake County. Both our pharmacies now sell and rent hospital and medical supplies. So if you need a walker, a rollator, a wheelchair, or a transport chair, we'll rent them to you or sell them to you if you prefer. We also have lift chairs and hand, wrist, knee, leg, and back braces for your comfort if you need them. If you're looking for a pharmacy that has great service, a $4.99-month generic prescription plan, free delivery service to Lakeport, Upper Lake, Nice, Lucerne, and now Kelseyville, as well as rental sales of medical supplies, then you need to come to Northlake Medical Pharmacies on Hill Road across from Sutter Lakeside Hospital and in front of the Brennos Shop Smart on Lakeport Boulevard.
Want to know what I like best about high school sports? I love watching my son run on the field. I love seeing him smile when he high-fives his teammates. I love seeing his eyes light up when his team scores a goal. I love the fact that since he's been playing high school sports, he's making better decisions. And I love knowing that high school sports have never been safer. Why? Because coaches have more information than they've ever had. Training techniques are more sophisticated, and equipment has never been more advanced. Playing high school sports isn't just safe. It's still the best way to give your teenager a healthy head start in life. And that's something I really love.
This message about the value of high school sports is presented by the California Interscholastic Federation and the California State Athletic Directors Association.
When I was a gang leader, we probably did business together. Because when people like you buy knockoffs on the street, often the money goes to gangs. And gangs use this easy money for other activities. In other words, they're getting a lot of bang for their buck.
Counterfeits hurt, but you have the power to stop them. Go to www.ncpc.org/getreal. A message from the National Crime Prevention Council and the Bureau of Justice Assistance, U.S. Department of Justice.
Captain Eric Lawrence was training Afghan soldiers when his truck was hit by an IED.
I was on the way from Kandahar to Swat, hit an IED that just took the truck and threw it up in the air and slammed it on the ground. I knew at first that I got hurt pretty bad because I couldn't move my legs. I sat home alone for months. I didn't want that anymore. I wanted to go back to work. I was hesitant at first, because I didn't work for a good year. I want to be a productive person. I don't want to be a drain on society. I want to be a positive thing in society. PVA helped me write my resume, got me a job interview. I got the job.
Helping veterans like Eric is what we've done for over 65 years. Paralyzed Veterans of America, paving access for veterans' employment through Operation PAVE. For more information, visit pva.org. A public service message from Paralyzed Veterans of America.
Okay, we're back.
All right, Paul, we're going to be talking about high blood pressure. You've got to see your cardiologist, so we'll see if you're one of those.
Yeah, I'm interested to see exactly what's going on. My wife seems to think I might be retaining water, but is that something that they'd be able to tell, like around the heart, or?
Well, we hope it's not around the heart because that's congestive heart failure.
We hope it's not that.
If you have it in your circulatory system, which is called edema, but what it does, that pressure of the water actually decreases the diameter of the blood vessel because there's pressure against the blood vessel. So when the heart has to work harder to get the blood through, it raises your blood pressure.
Yeah.
If you get rid of that fluid that's compressing those blood vessels, I always use the analogy of a garden hose. When you turn a garden hose on and squeeze it, the flow that's coming out of it is a lot less, and so you have to turn the pressure up on the hose to get the water to come out, or you release your hand, and that takes the pressure off the hose. Well, it's the same thing with the arteries and the veins in the circulatory system. When that fluid presses against those, I take a fluid pill, and I could, in the summertime, I could gain 5 to 7 pounds just being out in the sun.
Wow.
So I've been on a drug called Maxide for several years. Now, most water pills fluid pills will take extra potassium out of your system, and that's why I say I take 6 drugs. I have to take 3 potassium pills, even though Maxide, triametrine, is supposed to be a drug that doesn't deplete potassium.
Wow.
On me, it does. I'll never forget, I was in Chicago with a meeting, and I was due to come to Santa Rosa and have my last back surgery in 2005, and they had me go in and take a blood test in a Chicago clinic, and my potassium level was way too low, and they weren't going to operate on me because this was a 13-and-a-half-hour surgery, and so they called the pharmacy and ordered some potassium, huge amounts of potassium, to bring my potassium level up. So I got back in town on Monday. I went into surgery Monday night, and they tested my potassium, and it was high enough that they could do the test. But sometimes taking one drug will cause you to take 2 more because of the side effects of the medication. Excuse me. Blood pressure. Excuse me. Again, high blood pressure is called the silent killer because there aren't any real symptoms to it. And one of the forces behind your blood pressure is pumping the action of your heart. So to accommodate the surge of blood that's coming into your arteries, which are lined with smooth muscles that allow the vessels to expand and contract, and that maintains the blood pressure, so the critical organs are supplied between the heart contractions. So your blood pressure is also influenced by your kidneys. So what people don't understand is high blood pressure affects all your organs because all your organs need oxygen, and pumping the blood into your system is, and it carries oxygen, is how it's measured. So when your blood pressure reading is given in milliliters of mercury, such as it'll say mmHg on your blood pressure machine. It has two numbers. The first number, or the upper one, measures the pressure in your arteries when your heart beats. That's called systolic pressure. That's why it's so much higher, because it's measuring when the heart is beating. And that's usually, you want it to be at 120 or less. You can go clear up to 140 until that's when it becomes marginal. And the second, or the lower number, measures the pressure in your arteries between the beats. So you hear that beat and then another beat, but in between those two beats is the diastolic pressure. And that pressure ideally is 72, but it can be as high as 80 isn't a bad figure, but when it gets up to 90, and I confused you on the first number, the 120, when it gets up to 140, that's a problem. The lower one, when it gets up to 90, that's when it becomes a concern to the physician. So normal pressure is defined as really 120 over 80. Readings can be anywhere in between and still be safe. I just had a friend of a friend that was in his 50s. He was ate the right foods, was a great symbol of diet and exercise, always worked out every day, ran, and got up one morning and just dropped over dead from sudden death. That's not a reason for you to not exercise, Paul. That happens. And in his case, his blood pressure wouldn't have shown anything that was elevated. All of a sudden, a clot just got there, or an aneurysm. And so the continual occurrence of high blood pressure is going to stretch those blood vessels out, and the continual taking nutrition that isn't good nutrition, high animal fats and things, is going to also cause the diameter of the blood vessel to get smaller. So treatment of high blood pressure is usually a combination of lifestyle changes and medications. As we've always said, lots of physicians do not put people on medication when they come in initially with high blood pressure. It's called the white coat syndrome. In many cases, just being in the doctor's office, him taking or her taking your blood pressure is enough to cause your hypertension to exist and elevate the blood pressure to a point where it's more stress related by being in the doctor's office than it is anything else. So whether your numbers are borderline or just high, there's key steps to keeping your blood vessels healthy and your blood pressure under control. Of course, eating better, we know. A heart-healthy diet like the Mediterranean diet, which has a lot of green vegetables in it, primarily fruits, vegetables, whole grains, legumes. You've heard of all this. Omega-3 dairy products, fish high in omega-3, eat less red meat, avoid sugary foods. All of that we've talked about before. Watching your salt. If I have a problem, it's salt, and I've been diligently trying the last month to lower my salt intake. I mean, I used to whenever I would go out to dinner or something and order soup or a salad or meat or you name it, I would salt it before I would taste it. Tomato juice. I've seen people put, tons of salt in a Bloody Mary or just tomato juice to drink it, salt and pepper. That product, tomato juice, has more sodium in it than almost anything you can imagine. And so do canned soups and those kind of things. So that can increase blood pressure by having you retain more fluid. So, and Americans are terrible. They consume 50% more sodium than is recommended. They tell you to limit sodium to no more than 2,300 milligrams, about a teaspoon a day, and follow a no sodium or no salt diet. And processed foods are terrible. You wonder why that bologna in your refrigerator stays for a month, or those sausages without spoiling, and that's because they have so much sodium in it. So you might want to try dietary approaches to stop hypertension, which is the DASH diet. Ask your doctor about it, and the Mayo Clinic has it online if you want to go online to get it. If you don't have a computer, go to a library and come up with that. Getting more active. Same story we've said before. People with hypertension who exercise regularly often see a decrease in their blood pressure. 30 to 60 minutes of physical activity. I haven't been swimming the last week because of the weather, and I can feel the sluggishness. And that's, you talk about the tendency to have an addiction to wanting to have a cigarette or alcohol. Once you start exercising, you get like an addiction to that. You feel like if you haven't had that exercise that you're cheating yourself, and you get kind of frustrated because you're not able to do it. Limiting alcohol and avoiding tobacco. Too much alcohol raises your blood pressure and adds extra calories. I know a lot of people think that if I have a drink, I'll calm down, but normally it causes the blood pressure to elevate and inflame the blood vessels. When it inflames the blood vessels, the diameter gets smaller, and the heart has to work harder. And then taking the right medication and as you should take it instead of as you feel like you should be taking it. So a lot to taking blood pressure medication and diabetic medication and really being able to make a difference. And it's the kind of medication you take. I had a person that come in the other day, and they were on 180 milligrams of a medication, and the doctor said, increase it to 240. Just break the one that you're taking in half and take 1.5 every day. Well, it happens to be the medication that the individual was on was a capsule full of powder that was 180 milligrams, and you can't cut a capsule in two and take half of it out of there and know that you're taking the exact equivalent. So the patient had seen their cardiologist, and their cardiologist had gone for the day, and so we contacted, and the patient contacted the primary care physician. The primary care physician ordered the new drug in the new strength, and it was appropriate for this individual had just had some surgery, and it needed to be taken care of right away. So if you do that on your own, and the doctor tells you that, and you're not really informed about how much of a medication to take, and somebody says take half, and you have a capsule, and capsules aren't always completely full. So you may take half of it one day, and then the next day take a lot less than half of it, and you're going to have a fluctuation in blood pressure. So always think about those things, because physicians are in a hurry. Excuse me, they don't always see what's in your bottle. You may not even have the bottle with you. And different manufacturers put pills and capsules, different medications, same medications in a different base because of the solubility, meaning how well it dissolves within your system. So it's all about making medicine more efficient. The difficulty is going to be, as you have seen in Lake County, finding a physician that will take care of you, and most physicians are going to physician's assistants or nurse practitioners, and they will oversee several clinics. I have nothing against physician's assistants and nurse practitioners. And for example, there are things that pharmacists can do legally that I could be doing that I choose not to be doing because I don't have the expertise. And one is prescribing birth control pills. In California, pharmacists can do that without you seeing your physicians. I don't have a background in giving out birth control pills. The course that you take through the California Pharmaceutical Association to be able to prescribe birth control pills is a 2-hour course. I'm not prepared to accept the liability for my pharmacist or myself to prescribe birth control pills for without having the background to really know. These are hormones. These are dangerous hormones. People abuse the fact that they're taking them. Some people take Plan B contraceptives to get rid of a fetus after they've been declared pregnant, and then they continue to have unprotected sex. So I know we switched from blood pressure to prescribing, but I'm talking about if you're a complicated individual and you have more than one disease state, and you're trying to control diabetes, you're trying to control your weight, you're trying to control your blood pressure, obesity, hyperlipidemia, which is high fat content, and lower your cholesterol. That's a complicated regimen that you can't just look at. And the reason that pharmacists are involved in looking at all these medications is that's what we do for a living. We look at these medications and see if they're appropriate or not. Now, many physicians don't want us to tell them that this isn't an appropriate medication, and we find this quite often in compounding medications, which are taking the raw product and making it a specific percentage, and sometimes either there isn't an agent to put that drug in, meaning a base of some kind to titrate an active ingredient into, that will let it absorb through the skin. It may be a solution that we make up that the doctor orders that is not palatable because they're not going to be able to drink it if it's a liquid. There are, if somebody has a G-tube, a gastric tube, and we can just pour it into that tube, that's a different situation. But if it's an oral dose, then it has to be something that, number one, is palatable, so the patient will take it. Number two, it's going to reach the effective blood level to be an active ingredient that really does something when it gets into the system. So that's something we're going to be talking about a little bit later, the problem that happens with USP 800, which is a new law that's going to take place. We're getting down short on time, so I told you I was going to talk about the propositions that are 52 and 61. And there's differences of opinion, and I don't mean to offend anybody here, but 52 has to do with the hospitals having to pay money to process the Medi-Cal beneficiaries. And my first impulse in reading this was hospitals aren't going to want to have to pay to do those funds. And although it's called unethical in other forms of businesses, in this business, the hospital, every single hospital in California that I'm aware of is for Yes on 52. And the reason is there is $3 billion in federal matching funds to give to the hospitals that pay for the privilege of filling Medi-Cal recipients' medications. Both sides of the aisle, the Republicans and Democrats, are for this bill. Both senators and congressmen from both sides of the aisle are for this bill. I can't see any reason not to vote for yes on 52. 61 is the one that you see all the ads on for veterans. I happen to be a veteran. Vietnam, Korea, from 1967 to 1969. And the veterans' cost of medications right now is the lowest of any entity in the United States. What they pay for drugs is, and what the VA pays for drugs, is less than what anybody pays for drugs. And I'm not saying they should have an increase in the cost of medication. This law, 61, only applies to drugs paid for by the state of California and dispensed to medical plans, and most individual people that get prescriptions, this doesn't phase. I'm a little disturbed at the advertising that says we're going to rip off the veterans, of which I happen to be one, because they have the best deal there is. And I know that the drug companies are paying a lot of money to close to $100 million, I think, to defeat this bill, because what the other side says is they're going to increase their prices. Any drug company would be a fool to raise the prices on veterans at this point. So my advice through the Chamber of Commerce, because I'm on the Legislative Action Council, is to throw the dice. I don't want to hurt veterans, but the veterans have a great deal, and I don't see anybody trying to take advantage of them, including the state of California. But, we all have our choices. We all have our reasons. So I want to remind you that we're giving flu shots. I'll be gone on Thursday and Friday, but I'll be back. But we have a pharmacist giving immunizations at both locations without appointments. Remember, we deliver prescriptions now that we're getting into the winter part of the year for free to Lakeport, Upper Lake, Kelseyville, Lucerne, and Lakeport. So all you have to do is let us know a day ahead of time, and we'll be there. We're trying to sync your medications so you can get them all at the same time. I'd like to remind you we're Northlake Medical Pharmacy with 2 locations for you. At 5136 Hill Road East, across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno's Shop Smart at 347 Lakeport Boulevard, give us a call there at 263-1328. Thank you, Paul.
Thanks, Bill. We'll see everybody back here again. Will we be here next Wednesday?
Yes.
We will. You'll be back, yes. Next Wednesday at 10 a.m. for Health Talk on AM 1270 and 96.5 FM KXDX Lakeport.